What if I told you that right now, today, there is a number on your blood pressure reading that could be silently setting you up for a stroke? And the frightening part? Most people, when they see that number, think they are absolutely fine. Every single day, people just like you sit down in a doctor's surgery, roll up their sleeve, and watch two numbers appear on that screen. And you know what most people do? They glance, maybe they nod, maybe they feel a little relieved, and then they ask, "Is that okay, doctor?" But almost nobody, and I mean almost nobody, asks the one question that could genuinely save their life. They never ask, which one of those two numbers should I actually be terrified of? And that single question, that simple little question that most seniors never think to ask, it could be the difference between living a long, active, independent life and waking up in a hospital bed one morning, unable to speak, unable to move, wondering what went wrong. I have been practicing medicine for over 2 decades, and I can tell you with absolute certainty, there is one number on your blood pressure reading that is far more dangerous than the other for anyone over the age of 60. And today, I am going to tell you exactly which one it is, why it matters so much, and what you can do about it starting this week. My name is Dr. Clarence Martin. Welcome back to the channel. And if you are new here, welcome. I need you to stick with me for this entire video, because by the time we are done, you are going to look at your blood pressure reading in a completely different way, and that shift in perspective could save your life, or the life of someone you love. Hit that subscribe button right now if you want honest, clear senior health information every single week. Let's get into this. Alright, before we get to the part that is going to genuinely alarm you in the best possible way, I want to make sure everyone is starting from the same place, because I have learned over the years that most patients, even very smart, very educated patients, only half understand what those two numbers actually mean. So let us say your reading comes back as 123/83. That first number, the 123, that is your systolic blood pressure. The second number, the 83, is your diastolic blood pressure. Now, here is the simplest way I know to explain this. Your heart is a pump. That is its entire job. Day and night, sleeping or waking, it pumps blood through roughly 60,000 miles of blood vessels in your body, and like any pump, it has two phases. First, the squeeze. Your heart contracts, and it pushes blood out into your arteries with force. The pressure in those arteries at the moment of that squeeze, that is your systolic number, the top number. Second, the rest. Between beats, your heart relaxes and fills back up with blood. The pressure remaining in your arteries during that resting phase, that is your diastolic number, the bottom number. So you have got pressure during the squeeze and pressure during the rest. Two different moments, two different measurements, two very different stories about what is happening inside your body. And here is the thing that took the medical community itself decades to fully understand. And it is something that most GPs and family doctors still do not explain clearly enough to their senior patients. These two numbers do not carry equal weight when you are over the age of 60, not even close. For most of the 20th century, and I am talking about the 1950s, 60s, 70s, and even into the 1980s, the medical community was primarily focused on the diastolic number, the bottom number. If your diastolic was elevated, doctors were concerned. If it was normal, many assumed you were relatively safe. And look, there was some logic to that thinking. Diastolic pressure does matter. It tells you about the baseline tension in your arteries, the pressure that is always present, even between heartbeats. If that baseline is too high, your blood vessels are under constant strain. That is not good. But here is where the story gets really important for you. As researchers continued studying blood pressure over decades, and specifically as they started tracking what actually happened to older patients over time, they noticed something that changed everything. They found that as people age, the systolic number, the top number, tends to climb, while the diastolic number often stays the same or even drops. And most critically, they found that in people over the age of 50, the systolic number was a far stronger predictor of heart attacks, strokes, kidney failure, and death than the diastolic number. Multiple large-scale studies confirmed this. The Framingham Heart Study, one of the most important cardiovascular studies ever conducted, was among the first to clearly show that in older adults, isolated systolic hypertension was the dominant pattern and the dominant risk. This was not a small finding. This was a fundamental shift in how we understand blood pressure, and it changed treatment guidelines on both sides of the Atlantic, in the United States through the American Heart Association, and here in the United Kingdom through NICE guidelines. But here is the problem. The message never fully reached the patients. Millions of seniors today still look at their blood pressure readings, see a normal bottom number, and feel reassured, completely unaware that the number at the top might be quietly setting the stage for a catastrophic event. Why your arteries betray you after 60. So why does this happen? Why does that top number become so dangerous as we get older? The answer lies in what is happening to your arteries. And when I explain this, I think it is going to make a lot of things click into place for you. When you are young, in your 20s and 30s, your arteries are flexible and elastic. Think of them like a brand new rubber band. When your heart pumps blood into them, they stretch gently to accommodate that rush of blood, and then they spring back. That elasticity absorbs the force of each heartbeat and keeps the pressure from spiking too high. But here is what happens over the decades. Your arteries gradually stiffen, the walls thicken, calcium deposits build up, plaque accumulates. The collagen fibers that give arteries their flexibility begin to degrade, and slowly, those once elastic vessels become more like rigid pipes. And when your heart pumps blood into a rigid pipe instead of an elastic tube, the pressure spikes dramatically. There is nowhere for the force to go. There is no give, no absorption, just a sudden, violent surge of pressure every single time your heart beats. That is why systolic blood pressure rises with age. Your heart is working just as hard as it always did, but now the infrastructure it is pumping into is fighting back. And here is the other half of the story, the part that confuses so many seniors, because those same stiff arteries cannot rebound and maintain pressure between heartbeats the way young arteries can. So the diastolic pressure, the resting pressure, often stays normal or even drops. This creates a very specific and very dangerous pattern: high systolic, normal, or low diastolic. Doctors call this isolated systolic hypertension, and it is the most common form of high blood pressure in anyone over the age of 60 on both sides of the Atlantic. And I cannot stress this strongly enough. Isolated systolic hypertension is not something you can afford to ignore. It significantly increases your risk of stroke, heart attack, heart failure, kidney disease, and cognitive decline, including dementia. These are not small risks. These are the conditions that end independence. That end lives. The story that brings this home. I want to tell you about a patient. I will call him Robert, though that is not his real name. Robert was 72 years old when he came to see me. Sharp as a tack, retired engineer, still doing crosswords every morning, playing golf 3 times a week. He was proud that he rarely needed a doctor. He came in for a routine check. Nothing specific, just the kind of thing his wife insisted on. And when we checked his blood pressure, the reading was 168/72. Robert looked at those numbers, and then he looked at me with a smile and said, and I remember his exact words, "That bottom number looks pretty good to me, Doc. 72 is what you want, right?" And I understood completely why he said that, because 72 is a normal diastolic reading. In a younger person, 72 on the bottom would be fine. But Robert was 72 years old, and that top number, 168, was not fine at all. It was a serious warning sign. I had to explain to him that at his age, that 168 was putting him at significant risk of a stroke. Not eventually, not in some abstract future. Right now, today, that number was actively damaging his arteries, his heart, and his brain every single day he walked around with it. He was skeptical at first. I appreciate that. I like a patient who questions things. But we started him on treatment. We made lifestyle changes together, and over the following months, we brought that systolic number down to a safe range. Robert still plays golf. He still does his crosswords, but he does them with arteries that are no longer under siege, and I am genuinely grateful we caught it when we did. Robert's story is not unusual. I have seen versions of it hundreds of times, and the reason I am sharing it with you today is because you might be Robert right now and not even know it. What the numbers actually mean for you. So let us talk about the actual numbers, because I know this is what a lot of you are waiting for. What should your blood pressure actually be? And how worried should you be about your systolic number specifically? In both the United States and the United Kingdom, current guidelines define normal blood pressure as under 120/80. Elevated blood pressure, sometimes called pre-hypertension in the States, is when the systolic creeps between 120 and 129 with a normal diastolic. Stage 1 hypertension is 130 to 139 on the top. Stage 2 is 140 or above. Now for seniors, these targets can sometimes be personalized, and this is genuinely important. There has been vigorous debate in the medical community on both sides of the Atlantic about exactly how aggressively we should treat blood pressure in older adults. The landmark SPRINT trial, a major American study, found that targeting a systolic of under 120 in older adults significantly reduced cardiovascular events and death compared to targeting under 140. But that more aggressive target also came with higher rates of dizziness and falls, which in an elderly person can be just as dangerous as the high blood pressure itself. Similarly, NICE guidelines in the UK recommend treating systolic hypertension in over 80s to a target of under 150, recognizing that very aggressive blood pressure lowering in the very elderly carries its own risks. The research is absolutely clear on one thing: treating high systolic blood pressure in seniors reduces the risk of stroke by 30 to 40%, reduces the risk of heart failure, reduces the risk of cardiovascular death. Those are not small numbers. Those are extraordinary, life-changing reductions in risk. What your specific personal target should be is a conversation you need to have with your own doctor, because it depends on your full medical history, but the principle is universal. If you are over 60, your systolic number deserves your primary attention. Do not let anyone brush off a reading of 150, 160, or higher just because the bottom number looks reasonable. When the bottom number gets too low, now I want to take a moment to talk about something that does not get nearly enough attention, and that is what happens when the diastolic number gets too low. I told you earlier that diastolic pressure tends to drop with age due to arterial stiffness, and I told you that a normal diastolic reading is fine, but there is an important caveat here that your doctor may not have explained to you. If your diastolic pressure drops below 60, that can actually be a serious problem. Here is why. Your coronary arteries, the blood vessels that supply oxygen and nutrients to your heart muscle itself, they primarily fill with blood during the diastolic phase, during that rest period between heartbeats. So, if the diastolic pressure drops too low, your heart muscle may not be receiving adequate blood flow between beats. Your heart could literally be starving for oxygen while it is trying to work for you. This is particularly relevant for seniors who are on blood pressure medication. Sometimes, especially with certain drug combinations, the medication brings the systolic down to a safe level but pushes the diastolic too low in the process. This is called the J-curve effect, and it is one of the reasons why blood pressure management in older adults requires careful, individualized attention from a doctor who knows your full picture. So, the message here is not just about the top number, it is about the relationship between the two numbers. If you are on blood pressure medication and your diastolic is consistently below 60, please raise this with your doctor at your next appointment. All right, I never want to leave you with fear and no path forward. That is not what this channel is about. So let us talk about what you can actually do about your systolic blood pressure, because there is a great deal you can do, and I want to be very specific here. Number 1, move your body, not intensely, not painfully, just consistently. Regular aerobic exercise is one of the single most powerful tools available for lowering systolic blood pressure, and by aerobic exercise, I mean brisk walking, gentle cycling, swimming, even gardening. Studies have consistently shown that regular moderate activity can lower systolic blood pressure by 5 to 8 points on average. In terms of cardiovascular risk, that is genuinely significant. Aim for 150 minutes per week of moderate activity. That is 30 minutes, 5 days a week. Start where you are. Even 10 minutes daily is a meaningful beginning. Number 2, the DASH diet, and sodium specifically. DASH stands for Dietary Approaches to Stop Hypertension, and it has been extensively researched on both sides of the Atlantic. It emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy. It limits sodium, saturated fat, and added sugar. The DASH diet has been shown to lower systolic blood pressure by up to 11 points in some patients, entirely through food choices. The sodium piece alone is enormous. Current recommendations say under 2,300 milliliters of sodium per day. That is roughly 1 teaspoon of salt. Most people in the USA and UK consume significantly more than that. Watch processed foods, tinned soups, deli meats, and restaurant meals. The hidden sodium in those products is extraordinary. Number 3, weight management. I want to be sensitive here because I know this is a complex topic, but the research is clear. Even modest weight loss has a meaningful impact on systolic blood pressure. For every kilogram of body weight lost, systolic pressure can drop by approximately 1 point. Lose 10 kilograms, or about 22 pounds, and you could see a 10-point reduction. That is medication-level impact from lifestyle change alone. Number 4, stress management and sleep. These two are deeply connected and both directly affect your systolic number. Chronic stress keeps your body in a state of sustained activation. Cortisol levels stay elevated, which raises blood pressure. Finding daily decompression, whether that is meditation, prayer, time in nature, or simply sitting quietly with a cup of tea, genuinely matters. And sleep disorders, particularly sleep apnea, are strongly and directly linked to elevated systolic pressure. If you snore heavily, if you wake up exhausted despite a full night's sleep, please ask your GP about a sleep assessment. Treating sleep apnea alone can produce dramatic reductions in blood pressure. Number 5, limit alcohol. I know this is one that some of you may not want to hear, but the evidence connecting moderate to heavy alcohol consumption with elevated blood pressure, and specifically elevated systolic pressure, is robust and consistent. Current guidance on both sides of the Atlantic suggests no more than 14 units per week for women and men in the UK, and no more than 1 drink per day for women and 2 for men in the USA. And honestly, less is better. If you are currently drinking above these levels and your systolic is elevated, reducing your alcohol intake may produce results faster than you expect. Number 6, if lifestyle is not enough, medication. I understand that many people feel resistant to blood pressure medication. I hear it from patients constantly. Nobody wants to take pills if they do not have to. But I want to be very direct with you. If your systolic blood pressure is consistently above 140 and lifestyle changes alone are not bringing it down to a safe range, the risk of refusing medication is greater than the risk of taking it. The medications we have today, ACE inhibitors, calcium channel blockers, ARBs, thiazide diuretics, are safe, effective, well tolerated, and some of them have been in use for decades. They save lives. If your doctor has recommended medication and you have been putting it off, please have that conversation again at your next appointment. How to check your blood pressure correctly at home. Before we wrap up, I want to address something that I think is incredibly important for everyone watching, and that is home blood pressure monitoring. Because a single reading in a doctor's office is not enough. It simply is not. Blood pressure fluctuates throughout the day. It is affected by stress, by coffee, by activity, by the anxiety of being in a medical environment, something we call white coat hypertension. Some people's blood pressure is genuinely elevated at home, but looks fine in the surgery. Others are the opposite. A single snapshot does not tell the full story. If you are monitoring at home, which I highly recommend, here is how to do it correctly. First, use a validated automatic upper arm cuff, not a wrist monitor. Wrist monitors are notoriously inaccurate, particularly in older adults. Invest in a good upper arm device. In the UK, the British Hypertension Society has an approved list. In the USA, the American Medical Association validates devices too. Second, sit quietly for 5 full minutes before taking a reading. Feet flat on the floor, back supported, arm resting on a table at the level of your heart. No talking, no television, no scrolling your phone. Third, take 3 readings 1 minute apart and record the average. Do this at the same time each morning and evening. Keep a log. Bring that log to every doctor's appointment. That log is more valuable than any single reading taken in a hurried 10-minute GP appointment. Monitoring your blood pressure at home puts you in control. It makes you an active participant in your own health. And when you bring that data to your doctor, it allows them to make far better decisions about your care. Let us bring everything together. If you are a senior, if you are over 60, over 70, over 80, the number on your blood pressure reading that deserves your greatest attention is the top number, the systolic. Not because the bottom number is unimportant, but because the systolic is the number most strongly linked to the events that could take your independence, your mobility, your speech, your life. Arterial stiffness, the natural aging of your blood vessels, makes the systolic number rise while the diastolic stays normal. This creates a pattern called isolated systolic hypertension, and it affects the majority of hypertensive adults over 60 in both the USA and the UK. Millions of people, and millions of them right now, are looking at their bottom number, feeling reassured, completely unaware of what the top number is doing to their body. Please do not be one of them. The good news, and I mean genuinely good news, is that high systolic blood pressure is treatable through lifestyle changes, through appropriate medication if needed, through being informed and being your own advocate. I have seen patients in their 80s, their 90s, get their blood pressure under control and feel meaningfully better, more energy, clearer thinking, better quality of life. It is never too late. Please hear me on that. It is never too late to take action that matters. Here is what I want you to do right now. Go check your blood pressure after this video. Write down both numbers, and the next time you see your GP, your family doctor, ask them specifically, what is my systolic blood pressure doing? What should my target be? Am I at risk? Be your own advocate. Nobody cares more about your health than you do. If this video gave you something valuable today, if it shifted something in how you think about your numbers, please hit the like button. It takes 1 second, and it helps this video reach more seniors in the UK and America who need to hear this. Share it with someone you love, your spouse, your sibling, your parent, because the person you share it with might be Robert, sitting there feeling fine, not knowing. Subscribe to the channel for a new video every single week. Drop a comment below. Tell me what your blood pressure numbers have been looking like. I read every single one. I am Dr. Clarence Martin. Take care of your heart, take care of yourself, and remember, it is never too late to make a change that could save your life. Stay healthy, my friends.